Well, thank you so much for introducing me, and thank you so much, Millicent. It's so important to hear real life stories about the difference that we can make and the risks some people are facing. Thank you so much. It's hugely important to be here. We need to be united in our commitment, determination and drive to end new HIV cases by 2030. That still should be our goal. Bringing people together across organisations, across our different parties, with shared aims, it's an opportunity this year to refocus. And the publication of the government's HIV Action Plan for England today, it is a chance for the government to put its manifesto promises into action. With 2030 fast approaching, we need to see clarity of plan, real ambition and real resources put behind it, and we have some of that today. We need the government to keep on listening to those on the ground in our communities who know what's working and to do even more of it. To get back on track and achieve an end to new HIV cases by 2030, the government's plan needs to reflect the excellent work taking place up and down the country, including, of course, in my very cool constituency of Brighton Pavilion. So I'm immensely proud of the work of the Terrence Higgins Trust, who have their Brighton office just a very short walk down a little twitten away from my constituency office. I've spent time there seeing the incredible work that they're doing to end new transmission, to support people to live well with HIV, and to challenge the stigma that people face. They've been working with partners in the city like the pioneering Lawson Clinic at the Royal Sussex County Hospital and the local HIV charity Sussex Beacon. And it's so important and exciting to see the results of this. The emergency department at Royal Sussex has been doing opt-out testing since March 2022. It's being rolled out further in areas of very high prevalence already, and the government today has said new healthcare settings will receive it in a targeted way, and I'm very pleased to see that it's been funded to work across more emergency departments too in high prevalence areas. The impact of opt-out testing for each person whose HIV status is found and able to be treated is so massive for these individuals and for their risk of transmission. These are people whose HIV would otherwise almost certainly have gone undetected. And it has a real impact in finding people who may have been lost to treatment too. And normalising testing as part of a trip to A&E when blood is drawn also helps to reduce HIV stigma and the stigma that still exists around getting tested. This is an important intervention in so many ways. Brighton has also seen some really groundbreaking digital pathway work. The locally designed, co-designed HIV app Emerge has been a big success. This is a European project centred in Brighton, and I'm told people absolutely love using it, how convenient it is, the difference it makes. There are hundreds of people using this for PrEP access, appointments and support. And this clever and innovative approach has helped ease the pressure on local services and has freed up about 1,000 local appointments per year. Things like this in Brighton have shown the potential for digital PrEP access to make sure many more people get this targeted help, get this important help and real prevention. We need much more like this. And with more like this, zero transmission of HIV is possible by the target date of 2030. And the work of the Terrence Higgins Trust, the Lawson Clinic and the Sussex Beacon in Brighton proves what can be done. Thank you.